Pneumonia is a serious lung infection. It inflames the air sacs in one or both lungs. The air sacs may fill with fluid or pus. This can cause coughing, fever, and difficulty breathing. Pneumonia can be caused by different germs like bacteria, viruses, or fungi. It can affect anyone, but some people are at a higher risk. This includes young children, older adults, and people with weakened immune systems. Pneumonia is a common illness. It is a leading cause of death in young children and older adults worldwide. Understanding pneumonia is the first step in protecting yourself and your loved ones. Pneumonia symptoms can vary from mild to severe. The severity depends on factors such as the type of germ causing the infection, your age, and overall health. Common symptoms include cough, fever, chills, shortness of breath, chest pain, fatigue, and loss of appetite. Some people may also experience nausea, vomiting, or diarrhea. It is important to note that not everyone with pneumonia will experience all of these symptoms. Sometimes, symptoms may be mild and easily mistaken for a cold or the flu. If you experience any of these symptoms, especially if you are in a high-risk group, it is essential to seek medical attention promptly. If you suspect pneumonia, your doctor will start by asking about your medical history and symptoms. They will perform a physical exam, listening to your lungs for any abnormal sounds such as crackling or wheezing. To confirm the diagnosis, your doctor may order a chest X-ray. This imaging test can reveal inflammation or fluid in the lungs, characteristic of pneumonia. In some cases, further tests may be necessary. These can include blood tests to check for infection and oxygen saturation levels, as well as sputum tests to identify the specific germ causing the pneumonia. Pneumonia treatment depends on the type of germ causing the infection and the severity of your illness. Bacterial pneumonia is typically treated with antibiotics. It's crucial to complete the full course of antibiotics as prescribed by your doctor, even if you start feeling better before finishing the medication. Viral pneumonia often resolves on its own with rest and home care. Antiviral medications may be prescribed in some cases. Your doctor might recommend over-the-counter medications to relieve symptoms like fever and cough. Oxygen therapy may be necessary if your blood oxygen levels are low. In severe cases, hospitalization may be required for close monitoring and supportive care. Section 5. Breathing easy again. Recovery and long-term effects. Most people with pneumonia start to feel better within a few days to a week of starting treatment. However, it can take several weeks for your lungs to fully recover. During recovery, it's important to rest, stay hydrated, and avoid smoking and exposure to irritants. While most people make a full recovery from pneumonia, some may experience long-term complications, especially those with underlying health conditions. These complications can include lung damage, respiratory problems, and fatigue. Section 6. Shielding yourself. Prevention is key. Preventing pneumonia is always better than treating it. There are several steps you can take to reduce your risk of getting pneumonia and protect yourself and others. Vaccination is one of the most effective ways to prevent pneumococcal pneumonia, a common and potentially serious type of pneumonia. There are vaccines available for both children and adults. Good hygiene practices are also crucial in preventing the spread of germs that can cause pneumonia. This includes washing your hands frequently with soap and water, covering your mouth and nose when coughing or sneezing, and avoiding close contact with people who are sick. Section 7. A case in Point Mary's pneumonia story. Mary, a 65-year-old woman with a history of diabetes, developed a persistent cough and shortness of breath. Initially dismissing it as a cold, she delayed seeking medical attention. However, her condition worsened, and she began experiencing chest pain and fever. Concerned, her family took her to the emergency room. After a thorough evaluation, including a physical exam, chest X-ray, and blood tests, Mary was diagnosed with bacterial pneumonia. Due to her age and underlying health condition, she was admitted to the hospital for intravenous antibiotics and oxygen therapy. Section 8. The importance of early detection and treatment. Mary's experience highlights the importance of early detection and treatment for pneumonia. By recognizing the symptoms and seeking medical attention promptly, she was able to receive appropriate care, preventing potentially serious complications. Early diagnosis allows for timely initiation of antibiotics, which can significantly improve outcomes. It also allows for closer monitoring and management of symptoms, reducing the risk of complications and hospitalization. Section 9. Your health, your priority, seeking timely medical care. Pneumonia is a serious lung infection that can affect anyone. By understanding the causes, symptoms, and treatment options, you can take proactive steps to protect yourself and your loved ones. Remember, early detection and treatment are crucial for a full recovery. If you experience any symptoms of pneumonia, do not hesitate to seek medical attention. Your health is your priority.